Anserinus tendinitis or bursitis, often called PATB syndrome, is a condition that affects the inner side of the knee, causing pain, swelling, and sometimes instability. The anserinus region, also known as the goose foot, is where three tendons join at the upper medial tibia. This area plays a crucial role in stabilizing the knee joint, but it can become inflamed due to overuse, repetitive stress, or underlying arthritis. PATB is especially common in middle-aged and elderly individuals, particularly women and those with knee osteoarthritis. Recognizing the symptoms early, such as pain when climbing stairs or tenderness along the inner knee, is key to effective management. Traditional Chinese medicine, TCM, has long been used to treat musculoskeletal disorders like PATB syndrome. In TCM, PATB is considered an impediment syndrome or sinew injury, often resulting from imbalances in qi and blood, or from external factors like wind, cold, and dampness invading the joints. Treatments aim to restore harmony and unblock the flow of energy, using methods such as acupuncture, herbal therapy, and manipulation. These approaches are believed to not only relieve pain and swelling but also address the root causes of the syndrome, offering a holistic path to recovery. Randomized controlled trials, or RCTs, are considered the gold standard for evaluating medical treatments. Reviewing RCTs on PATB syndrome helps us understand how effective traditional Chinese medicine is compared to other therapies. By analyzing data from multiple studies, researchers can identify trends, compare outcomes, and determine which treatments provide the most benefit. This evidence-based approach is especially important for conditions like PATB, where both Eastern and Western therapies are commonly used. The review discussed here focused on RCTs published in the China National Knowledge Infrastructure Database between 2001 and 2021. Review analyzed 20 randomized controlled trials from a pool of 142 studies, focusing on those that use traditional Chinese medicine for PATB syndrome. These studies were selected based on strict criteria, including the use of RCT design and reporting on TCM interventions. Studies spanned 2 decades, from 2001 to 2021, and included a total of 1,498 patients. This comprehensive approach allowed the reviewers to assess not only the effectiveness of different treatments, but also trends in research and clinical practice over time. Across the 20 RCTs, the total sample size was 1,498 patients. Studies included a mix of men and women, with most participants being middle-aged or older. PATB syndrome is more prevalent in women and those with degenerative knee conditions, which was reflected in the study populations. The sample sizes varied, with some studies including fewer than 50 patients and others enrolling over 100. This diversity in patient demographics helps ensure that the findings are relevant to a broad range of individuals affected by PATB. Diagnosing PATB syndrome relies on clinical signs such as spontaneous medial knee pain, especially when climbing or descending stairs, and tenderness or swelling along the inner knee. Some patients also experience knee instability. In traditional Chinese medicine, diagnosis may also consider factors like qi and blood deficiency, or the presence of wind-cold dampness in the joints. Accurate diagnosis is essential for selecting the most appropriate treatment, whether using TCM, Western medicine, or a combination of both. Reviewed RCTs used a variety of evaluation criteria to measure treatment outcomes. The most common was the Visual Analog Scale, VAS for pain, used in 13 studies. 16 studies measured clinical efficacy rate based on symptom improvement, while others used knee function scores like the Lisham Knee Scoring Scale and the Hospital for Special Surgery Knee Score. Additional measures included quality of life inventories, range of motion, and recurrence rate. This diversity in evaluation helps provide a comprehensive picture of treatment effectiveness. Additional Chinese medicine treatments for PATB syndrome in the RCTs included acupuncture, manipulation, and external application therapies. Acupuncture was the most common, with various techniques such as acupotomy, ordinary needling, subcutaneous needling, and stiletto needling. Manipulation therapies focused on adjusting muscle balance and joint alignment, while external applications involved herbal plasters, fumigation, and hot compresses. Many studies combined these approaches with Western medicine for enhanced results. Acupuncture was used in 15 of the 20 RCTs, with techniques ranging from acupotomy, small knife therapy, to ordinary and specialized needling methods. Acupotomy involves using a small blade to release tight tissues, while subcutaneous needling targets trigger points under the skin. Stiletto and silver needle therapies use different needle materials and insertion depths to achieve therapeutic effects. These methods aim to relieve pain, improve blood flow, and restore knee function. Most frequently used acupoints in acupuncture treatments for PATB syndrome were SB10, SD35, SB9, and LR8. These points are located along the spleen, stomach, and liver meridians, which are believed to influence knee health and circulation. In some studies, acupoints areas of maximal tenderness were also targeted. The selection of acupoints is based on both traditional theory and clinical experience, aiming to relieve pain and restore balance. Manipulation therapy, used in 2 RCTs, focused on adjusting the balance of muscles around the knee, especially the patella. Techniques included tapping, rubbing, massage, and specific adjustments to restore proper alignment and reduce tension. These therapies were sometimes combined with microwave or other physical treatments. The goal is to relieve pain, improve mobility, and address the underlying causes of inflammation and instability in the knee. External application therapies included herbal plasters, fumigation, and hot compresses. These treatments use herbal formulas applied directly to the knee to reduce pain, swelling, and inflammation. Fumigation involves exposing the affected area to herbal steam, while plasters and compresses deliver medicinal compounds through the skin. Some studies combine these methods with manipulation or shockwave therapy for enhanced effects. Knee RCTs combine traditional Chinese medicine with Western therapies, such as steroid injections, oral medications, or physical modalities like ultra-shortwave therapy. These combination approaches often showed higher effectiveness than single treatments alone. For example, acupuncture plus ultra-shortwave therapy or subcutaneous needling with Western creams resulted in greater pain relief and improved knee function compared to control groups. Duration of treatments in the reviewed RCTs range from 5 days to 1 month, with 2 weeks being the most common period. Some therapies like acupuncture or herbal fumigation were administered daily or several times a week. The relatively short treatment periods reflect the acute nature of many PATB cases, but longer-term follow-up is needed to assess sustained benefits and recurrence rates. Almost all RCTs reported significantly higher effectiveness in the experimental groups compared to controls. Clinical efficacy rates range from 83% to 100% for TCM-based treatments, with improvements in pain scores, knee function, and quality of life. These results suggest that traditional Chinese medicine, especially when combined with other therapies, can provide meaningful relief for patients with PATB syndrome. Acupotomy or small knife therapy is a specialized acupuncture technique that uses a blade-like needle to release adhesions and relieve tension in soft tissues. This method is particularly effective for chronic pain and inflammation as it targets the root of tissue dysfunction. In the reviewed RCTs, acupotomy was often combined with other treatments, such as herbal therapy or physical modalities to maximize results. Subcutaneous needling, also known as floating needling, involves inserting a needle just under the skin near trigger points. This technique is designed to stimulate local circulation, relieve pain, and promote healing. In some studies, subcutaneous needling was combined with Western topical medications, resulting in better outcomes than medication alone. The procedure is minimally invasive and well tolerated by most patients. Stiletto and silver needle therapies use specialized needles made from titanium or silver alloys. These needles can penetrate deeper tissues and have unique properties such as high thermal conductivity in silver needles. The goal is to improve blood flow, reduce inflammation, and accelerate tissue repair. Studies found that these methods, especially when combined with other therapies, led to significant improvements in pain and knee function. Manipulation therapy aims to restore the natural balance of muscles and joints around the knee. Techniques include adjusting the patella, massaging tight areas, and strengthening weak muscles. By addressing muscle imbalances, manipulation can reduce pressure on the pes anserinus region and promote long-term recovery. Some studies also used elastic bands and specific exercises to reinforce these effects. Herbal fumigation involves exposing the affected knee to steam from boiling medicinal herbs, while plasters deliver herbal compounds through the skin. Common ingredients include achirons, bidentata, mirha, and carthami flows, which are believed to activate blood, resolve stasis, and reduce inflammation. These therapies are safe, non-invasive, and can be combined with other treatments for enhanced results. Several RCTs measured not only pain and function, but also quality of life using standardized surveys. Patients receiving TCM-based treatments reported better outcomes in physical, social, and psychological aspects compared to controls. These improvements highlight the holistic benefits of traditional therapies, which aim to restore overall well-being, not just relieve symptoms. Importantly, none of the reviewed RCTs reported significant side effects or adverse outcomes from traditional Chinese medicine treatments. This suggests that therapies like acupuncture, manipulation, and herbal applications are generally safe when performed by trained practitioners. However, more high-quality studies are needed to confirm long-term safety and effectiveness. Although reviewed RCTs provide valuable insights, most had limitations such as small sample sizes, short follow-up periods, and combined treatment approaches. This makes it difficult to isolate the effects of traditional Chinese medicine alone. Future research should focus on larger, high-quality trials with longer-term outcomes to better understand the true benefits and limitations of these therapies. Many studies combine traditional Chinese medicine with Western therapies, such as steroid injections or physical modalities. This integrative approach often resulted in better outcomes than either therapy alone. The findings suggest that combining Eastern and Western medicine can offer a more comprehensive strategy for managing PATB syndrome, especially in complex or chronic cases. Review highlights the need for more robust, diverse research on traditional Chinese medicine for PATB syndrome. Future studies should explore new herbal formulas, acupuncture techniques, and manipulation methods, as well as their integration with Western medicine. Long-term follow-up and larger patient populations will help clarify which treatments are most effective and safe for different groups. Clinicians, the findings suggest that traditional Chinese medicine, especially acupuncture and herbal therapies, can be valuable options for managing pes anserinus tendinitis bursitis syndrome. These treatments are generally safe and may be particularly useful for patients who cannot tolerate or do not respond to standard Western therapies. Individualized treatment plans, based on patient needs and preferences, are recommended. Patients who received traditional Chinese medicine treatments for PATB syndrome reported high satisfaction, with improvements in pain, mobility, and overall well-being. The holistic approach of TCM, which addresses both physical and psychological aspects, may contribute to these positive experiences. Patient education and shared decision-making are important for optimizing outcomes. In summary, the review of RCTs shows that traditional Chinese medicine, particularly acupuncture and herbal therapies, is effective for treating pes anserinus tendinitis bursitis syndrome. Most studies reported significant improvements in pain, knee function, and quality of life with few side effects. Combination therapies with Western medicine often yielded the best results, highlighting the value of integrative care. Healthcare providers should consider traditional Chinese medicine as part of a comprehensive treatment plan for PATB syndrome, especially for patients seeking alternative or complementary therapies. Collaboration between TCM and Western practitioners can help tailor treatments to individual needs, maximize benefits, and minimize risks. Ongoing research and education will further support evidence-based practice. Evidence from randomized controlled trials supports the use of traditional Chinese medicine, especially acupuncture and herbal therapies, for P's anserinus tendinitis bursitis syndrome. While more high-quality research is needed, current findings suggest that TCM is both effective and safe, particularly when integrated with Western medicine. As research continues to evolve, patients and clinicians can look forward to even better treatment options in the future.